Can you see me, Chair?
Yeah, we can see you. We can see you very well. Honourable members, please keep your videos on. We want to see you. Don't disappear. We don't want to see initials. So just make sure that you please mute, but the videos should remain on. Honourable Tikhale.
Dumelang Malukwa Parliament.
I'm here,
Chairperson. I'm here.
Thank you so much. Honourable Matafa. Honourable Matafa.
Yes, Chairperson. Good afternoon. I'm here. Good afternoon, all the members. Can you hear me?
Yes. Good afternoon. Welcome. Is Honourable Kumane in?
I don't think Komani is still a member of this meeting.
Oh. Okay.
Yeah,
okay.
there was something like that. There was a notice. Remember the other, is it Rosina, the other colored-ish lady, Adonis or somebody? She came to one of the meetings and said that she is now a new member.
Okay.
Just before we went on recess, Chair.
Okay. Is there any other honourable member that I left out who's around?
Languini.
Sheikh Imam.
Honourable Sheikh, please, are you in? Let's see you.
Can you see?
Keep on talking.
Can you see me, Chair?
Keep on talking, please.
Okay, I can see myself, Chair, and I can see you. I can see the lovely lady. I can see my other colleague there.
Okay, Honourable Peters, we are there.
Yes, she just left, Chair.
Okay, thank you. Welcome, honourable members. Honourable Peters, Honourable Ntlangwini, and Honourable Nkwankwa. They tender their apologies. As perhaps before I start, can I take this opportunity to wish Honourable Mlenzana a happy birthday? I'm told he's turning 21 years old. Happy birthday, Honourable Mlenzana.
Thank you so much.
Happy birthday,
Okay.
Zola.
Yes, I'm 21.
Many more. Unfortunately, I couldn't bring the cake. I'm here, and we are social distancing. Is it not so?
I didn't know that you're a Taurian.
Yes, I am. Thanks, Chairperson.
Thank you. As I said in my introduction, we are having Human Sciences Research Council, who are going to make a presentation to the committee. I would like again to welcome Professor Sodin, who's the CEO of HSRC. Welcome, sir. We agree that perhaps just take 40 minutes, and then the better part of the meeting will be responding to the issues that would have been raised by the honourable members. Welcome. You may introduce your team. Your team is there. Thank you.
Yeah, thank you very much, Honourable Chairperson Buthelezi. So it's a great honour for us to be here, colleagues, in these very strange circumstances. So we have been, over the last few weeks, getting used to operating through these media, through this technology, and I hope that we are able to do justice with our presentation to this, to the questions that you have put to us, Honourable Chair. So with me are our colleagues. First of all, Professor Nanya Böhler, who I think Darren is trying to, or she's struggling to get the video alive. I think her audio is good, but not a video. So if you can help, please, Darren, that would be good. We also have Professor Charlene Swartz, and she will go after Professor Böhler. And then will come Chairperson Professor Kangalani Zuma. And finally, to conclude our presentation, and that will be the last thing that we will say, will be from Dr. Glenda Cruz. So we will try and get through this presentation quickly and take it as read that colleagues would have been able to peruse the document at their before we came to the meeting, and so we won't be dwelling in detail on particular issues to allow us to get to the conversation. So I'd like to start, if that's okay with you, Chairperson. Is that all right?
Yes, please. And as you call your other colleagues, it's all in your hands. We'll just be listening.
All right. Yes, thanks. So the way in which we're going to do this, and I'm saying this also to my colleagues, we've already said it. When you come to the end of your slide, I'm not going to introduce the new presenter. We will seamlessly go into the next presentations. So there are 4 colleagues of mine that will be presenting, Chairperson, and I'm going to be expecting of them that they will pick up simply when the last person has finished. Let me also say that we're supposed to be accompanied also by our deputy chairperson, my deputy, Professor Kangalani Simbai, but he's struggling to get in, Darren. He's struggling to be connected, but I hope that he will be able to join us later on, Chairperson. So can we go to the slides, please, Noor? Slide number 1. So thanks very much. So this is the outline of the presentation that we're going to be making here this afternoon, Chairperson and colleagues. We're going to begin with 3 or 4 slides, which will quickly, and I will do those, summarize the mandate of the HSRC. We will then substantially move on to my colleagues, and we will begin with Professor Bola Muller, who will do the slide on the slides on service delivery. We will have then the presentation on inclusive economic development, and then the next one will be on health, and finally we will close on innovation, science, and technology. So I'd like to begin with what our mandate is, please. Next slide, please, Noor. So most colleagues and most honourable members are familiar with what the mandate of the HSRC is. We are a publicly funded research entity for the social sciences, and our mandate in terms of our act is to initiate, undertake and foster strategic basic research, to stimulate public debate, to respond to the needs of vulnerable communities, to address vulnerable developmental challenges, to build research capacity, to inform the effective formulation and monitoring of policy. And this is largely what this presentation is all about. We also seek to foster research collaboration and develop new and improved methodologies for research. Next slide, please. This is a very important slide, Chairperson. So this slide is an attempt to place the HSRC in this large landscape of research entities in the national system of innovation, in their contribution to the National Development Plan. This slide contains the theory of change with which the HSRC is going to be working for the next 5 years, for the next medium-term strategic framework. The crucial point to be making about this particular slide here is that it shows where the HSRC's mandate, in a sense, comes to a climax. And that is essentially with those 2 rows, the 3rd row and the 4th row. In those rows are indicated the contribution that we expect to be making through our research to these major priorities that are contained in the National Development Plan. And those priorities are to inclusive economic growth, to developing the capabilities of South Africans, and to the developing a capable state. Our purpose is to be able to produce the research which is going to culminate in those outcomes, which are then, in a sense, put at the disposal and for the benefit of the policymakers to be able to advance the interests of the National Development Plan. I'd be very happy to take questions about all of this, but this framework that you see here is in keeping with the guidelines that have been given to us by DPME in terms of trying to explain and emphasize how the work that we do will impact on achieving those big aims which are embodied in the National Development Plan. Next slide, please, Noor. We will also ask Chairperson to give you an indication of how the COVID-19 is going to be impacting on our ability to be able to fulfill our mandate. And we'd just like to signal in this particular slide, and I won't dwell on the challenges, but there are going to be real challenges for us in terms of how we fulfill our mandate. The major challenge which we are encountering, and it's experienced immediately, is that we are going to be having a reduction in our parliamentary grant. And that reduction in our parliamentary grant is going to have ripple effects in both upward ways and downward ways. In our ability to be able to meet some of our targets, but also clearly in our capacity to be able to fulfill some of the objectives that we have set for ourselves. And we were in a meeting today with our department. In that meeting, we discussed how our performance plans, our strategic plans will have to be adjusted as a direct result of this shift in our reduction in our funding. I'd like to now hand over Chairperson to Professor Nanya Bola-Muller. Over to you, Nanya, please. I'm going to mute now.
Thank you very much. I hope that you can hear me.
Yes, we can. Thank you.
Thanks. So I'll be speaking about service delivery, vote for, and other linkages. Next slide, please, Noor. I know that we are going to have to rush through this slightly. On the left-hand side of the slide is information that we already know. The growth forecast to decrease, this has been said by the IMF, by 5.8% by December 2020. SARS revenue shortfall of 66 billion. Debt to GDP ratio at 65.6. And obviously the policy response then has been to cut the budget across government. So in terms of service delivery, some of the concerns that we have that come from our research are the following. There is a concern around the cut for local government and management components of vote for, because it's primarily for performance monitoring. And this is very concerning because this is where delivery happens. And there are already challenges at local government in terms of service delivery. And we do believe that this poses a risk. In addition, the cut for traditional leadership component of vote for is a cause for concern. We believe so because in the rural areas, traditional leaders need to be there for the people, especially in this time of COVID-19, where support is required in the rural areas. And a lot of this does come from traditional leadership. Lastly, the shortage of water and supply through water tanks is already overstretching the fiscus and will continue to do so. Next slide, please. So what to consider from the research that we've done is the multi-dimensions of human insecurities. And so in terms of food, several surveys have indicated the high prevalence of hunger. A survey that we have done with the University of Johannesburg has indicated this, and I will give you some information about that shortly. In terms of water as well, personal and individual hygiene requires reliable access to clean water, and will indicate to you there also where the challenges are coming from the survey with the University of Johannesburg Centre for Social Change. Sanitation and waste removal are essential basic services to ensure personal and household hygiene, and special attention should be paid to this. We know that health reallocation has been made of 20 billion, but we believe that this is not sufficient in the context of other social determinants of health, and also the concern around the public versus private divide.
Professor No.
Yes.
Please switch on your video. We don't see you.
Oh, I'm sorry. My video.
Your camera.
Sorry, my camera is not working for some other reason. So I do apologize for that. But there seems to be an error here.
Okay, that's fine. Can I just remind the other presenters that please, they would have to switch on their cameras before they talk. Thank you. Continue.
Thank you, and apologies for that. In terms of economic opportunities, we're also very aware of protecting household income. This is also coming through in surveys and in our survey. The issue of jobs, really important, formal and informal, and social protection is obviously very important and welcome. However, implementation on the ground is sometimes of a challenge. We'd also say that investment in basic service infrastructure is critical before the pandemic, now and afterwards, and for general community and household resilience. We'd like to see the fact that people are coping and that they would be resilient. Next slide, please. So in the survey that I mentioned, it's called the COVID-19 Democracy Survey that my program, Developmental, Capable and Ethical State, has conducted with the University of Johannesburg Centre for Social Change, has indicated some disturbing data around the frequency of hunger during lockdown. There's a bit of a cutoff at the bottom. So the first one is townships or RDP houses. There you can see that the prevalence of hunger is relatively high. The second one is backyard shacks or rooms in backyards. And the prevalence of hunger there is almost 40%. Informal settlements without backyards. Again, people are going to bed hungry. And that is at 43.3%. As expected, people living in houses in the suburbs are getting along a little bit better. In terms of only 9.3% of people going to bed hungry, but this is something that is significant. People living in flats, apartments, or any form of townhouse. Again, we see that it's slightly higher than in the suburbs. The highest level of hunger is experienced in hostels. This is where people live in close contact with one another, such as workers, migrant workers, and also student residences. In rural areas, the levels of hunger are also high, but to some extent not as high as in the in the townships. So the national average for this is almost 30%. I'd like to point out that we have had 2 phases for this survey, one from the 13th to the 18th of April, and that is the outcome that we are reflecting here. We had another survey phase from the 18th to the 27th of April, and we are still waiting this information. But what I can tell you is that there has been an increase overall of 5% just in that short period of time of people experiencing hunger. And the most of the increase is in informal settlements without backyards, but also in the suburbs. The next slide, please. This is the same, basically the same kind of trends that we can see, asking if someone else in your household has gone to bed hungry. And again, the hostels or residents stand out there at 32%, whereas the national average is 17.8%. But it is a very similar pattern or trend as the previous slide. So I'll go to the next one. The source of water, this is really essential because of the issue of hygiene, the washing of hands, and making sure that when people go out into the public, that they are not going to be infecting others. And the source of drinking water for households, I'll focus on people who have taps in their houses. So you can see there the lowest percentage of people with taps in their houses is backyard shacks and rooms in backyard shacks. Very, very low percentage actually have taps in their houses. And of course, the lowest percentage, and this isn't too much of a surprise, is informal settlements without backyards, which is as low as 16.5%. In addition, in the rural areas, there are many households who do not have taps in their homes and therefore have to fetch water elsewhere. And the national average of people with taps in their households is only 60.5%. And another issue that is the use of public taps or having to go out to fetch water to clean. So we need to really take that into consideration when we look at service delivery. Next slide, please. We asked one open-ended question: what would be a message that you send to President Ramaphosa? And we had over 5,000 messages that were written out. People took the time to do this, and we don't really have much time to present. So I'll just quickly run through the first quote there. To thank the president. And there is a lot of appreciation that is shown. In fact, the popularity of the president in handling the COVID-19 virus is standing at 72% of the population. However, there's also thanking for the child grant. However, it is indicated in this quote that Athlone is struggling to get food packages. And the other issue that is raised at the end is what is going to happen to us youngsters? Before the outbreak of COVID-19, we struggled, we still struggle. That is basically the essence of that. And it ends by saying, I salute you, Mr. President. And this is from a male respondent from Athlone in the Western Cape. The second quote Mr. President, I'm glad and grateful for the humanity you are showing to us fellow South Africans, and I'm glad that you acknowledge that there are people who are really in need. A male from Orange Farm in Gauteng. The third quote, "Hi, Mr. President. Hi, President Cyril Ramaphosa. You see, for us, life is very hard. No food during the lockdown. People will not be killed by COVID, but they will be killed by hunger." This is a female respondent from Durban in the Northwest. The last quote, "Mr. President, please help us. We don't have enough space. We don't have water. We used to go to the river to fetch dirty water for drinking, and the animals used to drink that water too. Thank you." A female from KwaZulu-Natal. So you can see there is praise, but there is also a lot of need that is out there. And as I say, we have 5,800 of these messages to the president, very touching messages, which tell us what people are saying. Next slide, please. Just to wrap up then, we have made some recommendations for focal areas. They're not very surprising. To focus on social protection for the poor and marginalized, to cushion and build resilience. So increased grants and small business support is very welcome, but we must also keep in mind that implementation on the ground must be attended to. The second point is enhancing health systems responsiveness and resilience to current and future shocks. So the universal health care and national health insurance, in the view of our research, is a must to ensure equitable access to health services. We need to build local capabilities for service delivery through improved basic services infrastructure, most importantly, water, sanitation, and energy. And then lastly, we want to emphasize that the proposed new district planning model launched by the presidency and being piloted by 3 provinces should receive high priority to be rolled out in full scale for addressing service delivery backlogs. And we are doing some research in this area as well and would like to continue to do so despite the budget cuts. That is me for now. Thank you very much.
Good afternoon, colleagues. I'm going to be speaking a little bit about some of the economic areas as well as the educational areas. You can move on to the next slide, Noor. A few years back, we provided this committee in the last administration with a practice note where one of the key things around deciding between economic priorities was to just have a set of questions that you keep bringing into the conversation. And so the questions are really around, are public resources being allocated in an optimal way to foster growth? And are public resources being used properly? There's quite a lot of thinking behind some of those questions. And at the time, those questions included questions like downgrades and cost-benefit analysis, etc. Now we also have the issue of COVID. And so in a sense, it's allocating, are they being allocated in an optimal way to foster growth, but also what is the impact of COVID on the allocations. Next slide, please, Noor. This next slide is a screenshot of a very large Excel spreadsheet. And I'm not wanting to go at all into the detail, but I'm wanting to show a mechanism that we have used to do some of the analysis from the unit that I'm responsible for, filled with economists and sociologists, but also taking quite a keen look at the social implications of the current situation in which we find ourselves, both short-term with COVID and long-term in terms of the poverty and inequality in South Africa. So what we did is we actually, instead of just offering some evidence around the work that we've done, we looked at a number of the budget votes. And we asked the question, what does COVID, how does COVID impact, for example, the Community Works program? And so the criteria that we used to analyze it were things like, does the Community Works program offer opportunities for prevention, for containment, in making sure that the community works program, for example, goes into schools, does cleanups, does social distancing, does the public works program do the same thing? And so we had a few criteria around prevention, containment, kind of stimulating the supply side in terms of getting the economy going, and various other categories. And then we also had a second column with government priorities, and we 4 or 5 of them, and which ones are the priorities in this particular budget vote. Next slide, please, Noor. So I share that matrix because in one sense, what we're really interested in doing in the longer term is looking at the budget votes through this assessment matrix. It's not modeling because I think that's too fine and granular, but it's taking some of the competing priorities and keeping those in mind as we think through what should change and what help we might offer the committee both from our evidence base and from our expertise, but also in terms of the country's priorities and the priorities that COVID bring to us. So in terms of votes 3 and 13, public employment, that for us is really incredibly important that we ask ourselves whether the budget increase of 2 to 3% is sufficient. And the answer is it really isn't, because there's a possibility for those votes really helping us cope with COVID, but also some of our long-term priorities. And so vote 3 we think is insufficient. Vote 16 on school nutrition. Again, one of the things that COVID has laid bare is the fact that the inequality, the precarity of young people and children's access to nutrition is really precarious, and that COVID is going to increase the amount of young people who are going to be in need of school nutrition because parents and caregivers are going to have employment challenges. Next slide, please, Noor. In terms of social development, I think the one area that I would like to draw to the committee's attention is that research across the globe has shown that when we abruptly withdraw social assistance, and so in the South African context, at the end of 6 months, without alternate intervention, there is likely to be a potentially destabilizing impact on the economy, on poverty, but also on social cohesion. We are likely to see some form of social protest. And I think that's really important. The issue around social welfare, we are going to have a demand for social and psychosocial help arising from death, displacement, loss of income, and that's something for the committee to think around. There is an 18 to 27% increase in the budget, which is welcome, but will it be enough to address some of the fallout at the end of the COVID crisis in 18 months or 2 years' time? Early childhood development, and here just a comment on, I suppose, what we're doing at the moment with the appropriations is we're thinking both short-term and long-term. This year over the medium framework, and we're thinking about our national priorities, and early childhood development is certainly a national priority, and so a 76% increase is welcome, and it really should be protected is really what we're saying. Even though it may be a long-term goal and not help to mitigate the crisis that we're facing right now, it really must be protected, that budget vote. The National Development Agency, I think we've seen in the media and certainly on the ground over the last 5 or 6 weeks, the incredible role that the NPO sector have played around feeding hungry people. My colleague has spoken about those statistics, and government, yes, has tried to deliver food aid, but actually there's been so much grassroots initiatives from NPOs, and so it would be a priority and it would be strategic to ensure that is also protected, to enhance partnerships with the NPO. And at the moment, it's less than 6% the increase, and that must be protected, if not increased. Next slide, please, Nora. In terms of vote 29, agriculture, land reform, and rural development, I just want to make one point on this slide because I am taking it as read. And that really is the fact that of the policies and the plans that the Department of Agriculture and Land Reform have put in place, food security, food safety and land reform, smallholder farming, and capacitating rural youth are their priorities. Now, one way in which we can address almost all of those priorities is to prioritize secured farmland access and use for smallholders and householders to enable them to expand food production and distribution. And so, in a sense, there is an allocation for all of those priorities. Again, they need to be protected because what they do is they address our long-term priorities as a country, but they also will be a mitigating factor around the COVID crisis. So if people have access to small holdings and they can farm them, there'll be more food security, and it'll also address the issues around land reform. So one action actually can address multiple priorities. Next slide, please, Noor. There's so much we could have said about vote 16 on basic education. There's so many needs. And so I think the one thing we wanted to draw attention to was that infrastructure spending is still critical. It sounds like the kind of thing that we could put off, but it is both a mitigation around the COVID crisis and a long-term priority. The one thing that I did want to just mention, because it's kind of been in the media, but it's also part of a conversation that we had with the committee last year, and that was around the president's ideal of procuring and having tablets available for every child in the country. And at the time, it was really important for us to think through, how is it going to work from a safety point of view, from an electricity point of view, from a teacher preparedness point of view, from a mass procurement point of view. What the crisis has done is made us see that if we don't go a route of including technology into education urgently, the lines are going to just be wider and the divides are going to be wider in terms of education. And there's so much work being done on the continent about procuring laptops and technology for young people and children in rural areas and impoverished contexts, that it should be something that we should think about allocating resources to now and not thinking of it as a kind of a luxury for the future, but actually it could mitigate an incredible amount of the inequality that we're currently seeing. Next slide, please.
Can I interrupt you?
Yes.
You have the 10 minutes to finish the whole presentation, Prof.
Sure. I've got two more things to say, and just 2 sentences. So vote 17, higher education. The only thing I wanted to draw attention to is the reduction in infrastructure spending at HIVAIDS, and I think that needs to be reconsidered. There's a huge debate around how young people should be taking up HIVAIDS more, and that is the future for prosperity and growth. And then just one other warning is the universities are likely to face a second crisis after COVID. We do a lot of work with students and around protest, and there's calls for tuition and resident refunds. And a lot of the universities are not going to be able to cope with that post-COVID crisis. And so that's just something for noting. Human settlements, Noor, won't you move on 2 slides? The only issue on this one that I wanted to draw attention to is de-densification. That needs some consideration by the committee. Backyard housing is a potential avenue for alleviating some of our current problems for housing. And the shift from subsidy housing to service site is also a potential area for social protest going forward, because that's a big change in the human settlements debate. Thank you.
Thanks, Chairperson. So we're going to try and accelerate. Kangalani, over to you, please.
Thank you very much, Crane, and good afternoon, honorable members. The issues around health, if you could move on to the next slide, Noor. The issues around health that we'll be looking at, and coupled with the advent of the COVID-19, the advent of the COVID-19 has actually posed a challenge and tested the strategies of health promotion, especially the main 6 building blocks of health promotion strategies, and addressing these key constraints that are faced or that have arisen due to COVID, faced by our health system, will require a reorientation of our health system towards a comprehensive primary health care and an institutional reform at different levels, especially the health behavior, health information, and health literacy, both at the primary prevention level up to the early detection and patient care level to deal with these pandemics that we face. If you could move to the next slide, no? Now, the COVID-19 actually has really been a challenge that we face. And we look, for example, at the elements of how our health system has responded to the epidemic. And it has become apparent that the basis of our health promotion is key, especially to prevent diseases. We've organized a study to look at the knowledge about COVID prevention, for example, in our society, because we understand that as social scientists, that medical interventions alone, without social and behavioral interventions, have failed to treat the society out of the epidemics, be it HIV or TB, and now the COVID that we face. For example, what we've seen is that in our society, there is high level of knowledge of COVID, how it is prevented, and also that one is to stay away from people who are infected, and also not touching and washing hands, for example, frequently. Knowledge is very high, but the question remains, does this knowledge translate to change of behavior? And that is where behavioral and social science research become important. If you could move to the next slide, no? Next slide. Now, what we've seen in the budgets, what we've seen in the budget is that the health budget annual average growth of 5.1%, for example, given the challenges that we face, it's really not enough to actually deal with the health challenges that we face. The experiences of people, for example, during the current lockdown, based on the research that we've just conducted, show that approximately 13.2% of the population indicated that their chronic medication, for example, was inaccessible during this period of lockdown. And between 13 and 25% of those people were in informal settlement and also other areas such as rural areas, for example. This speaks to the challenges that our people face even without corona as an epidemic, but access to these primary healthcare services is not easily available. And this health expenditure, for example, as we see on HIV and TB malaria outreach, that has shifted up to about 24 million, which is an increase of about 11%, will certainly not be sufficient to deal with such epidemics that we face. If we move to the next slide, no? Okay. Now, at the moment in South Africa, we are dealing at the same time with at the same time with COVID, we're dealing with another epidemic, which is HIV, whereby about 1.51% of young girls are living with are annually infected with HIV, and only 39% of these HIV positive young men and women are actually on treatment. And this is the group that is the smallest of the society that has access to treatment. Now, if we look at HIV interventions in terms of treatment, can not only be the clinical interventions, we also need to look at behavioral intervention. That is one way to change the dimension or the direction of the epidemic. Now, if you look at the allocation in terms of our budget that we have, is that we see the social impact bond allocation that we see begins to address these behavioral issues among young girls. But this seems to be focusing more on clinical research instead of or clinic allocation towards clinical work instead of being put directly to institutions such as HSRC, which is more appropriate institutions for doing behavioral research. Now, reprioritizing, for example, the 800 million from HIV/AIDS component to address funding shortfall is already a challenge, especially given with what we are facing with HIV at the moment, now with COVID, and we don't know how the epidemics together plus TB are going to evolve. So we really require a lot of resources to address these epidemics going forward. If you move to the next slide, no? So the implications for this outbreak that we face, the COVID outbreak, is that we really need to establish a constant data collection in terms of what we call an observatory to collect information so that we can use that information to respond timelessly to these disasters. The core of, for example, of the observatory concept will need to be in line with the policy intent, for example, of our white paper. And also the other thing that we need to look at investing our resources into is to establish something that one would call a South African social stigma scale, to establish a contextualized social stigma scale that is culturally and contextually grounded, which will assist the social responsibility, participatory citizenship, and nation building. And institutions such as HSRC, a social science organization, can play a coordinating role in dealing with such epidemic, because we cannot treat ourselves out of this epidemic, but investment in social sciences and behavioral research is one of the many ways that we can use to deal with the epidemics and the pandemics that we're facing. Thank you very much. On that note, I'll hand over to my next colleague.
Thank you, Kangelani. Colleagues, this is Glenda Cruz from the Center for Science, Technology and Innovation Indicators. And I'll start by picking up on a point that Charlene Swartz made, and that is if we look at the current votes, there is a lower growth in the innovation, science and technology vote. And although it has increased, the percentage at which it is increasing is lower than the average. And we have a temptation that we might want to cut from this vote as one of the places in which we can cut. But what our research is showing is that more than ever now, we need our innovation, science and technology to help us be prepared to respond to all these multiple developmental challenges, whether it's health service delivery, the economy, or social delivery, service delivery. So if we look, the basic starting point is that innovation, science and technology are critical to structural economic reforms. They're critical to inform us how to promote productivity, investment, but also inclusive and sustainable development. But if we look at the next slide, we're seeing that we have a slight problem in that our growth expenditure on research and development as a nation isn't growing significantly. It's fairly a static line over time. And if we look at the next slide, we're seeing that increasingly the expenditure on R&D relies on the public sector, on government through higher ed and science councils. And also, if we look at the next slide, please, at the sources of funding for research and development, we're seeing that that is increasingly also coming from the public sector. And we're raising critical alarm bells here because we have got a decline in the private sector expenditure from business on science, innovation and technology. And that means that our national system of innovation cannot grow as fast as it should, and that then constrains future growth and development. And if we look at the next slide, please, we can see that South Africa, that compares different countries to see what proportion of R&D expenditure nationally comes from public and private sources. And you see that South Africa differs quite significantly in the reliance on the public sector. So the question then becomes, how does this, what happens under COVID conditions? And what we're suggesting is that the COVID challenges actually intensify the problem. Our CEO has already mentioned how there are cuts from the HSRC, which is part of the R&D budget, to redirect to COVID priorities. And so there'll probably be more cuts in innovation, science and technology, and that'll impact negatively on the future growth and development potential. But you might ask why this is so important. And to illustrate that, I want to just look a little bit at the expenditure on health. If you can look at the next slide, please, Noor. When we look at the response to COVID on the health front, I think we can be quite proud of what we've been able to do as a country. For example, we've seen South Africa, we've been able to sequence the genome, we've been part of international projects, we're busy with vaccine trials, etc. And that is only possible because over time there has been quite a good investment in health R&D. So you can see on this slide that there has been around 20% of the gross expenditure on R&D has gone on health-related research. And that means that when we had a crisis, the system is relatively well prepared to be able to respond. But we're raising questions about whether this is sustainable and whether this is sufficient for us to be able to respond effectively to the crisis. And that relates, if we can go on to the next slide, please, again to this issue that if you look over time, there's less and less private sector expenditure on R&D and more public sector expenditure. So the system is increasingly relying on government, and when there's competing demands for government, then it is likely to decrease, and therefore the investment might not be sustainable and it might constrain our capacity in future. So what we are saying is that at this point in time, we need stronger prioritization of expenditure from the public sector on innovation, science and technology, and we need stronger promotion of increased private sector expenditure. And the last slide I want to just, if we can go on to the last one, please, Noor, to talk to is some evidence from our survey of business innovation. And what we find there is that there's an opportunity, a policy stimulus mechanism that we haven't really taken full advantage of. And that is to include an innovation requirement within public procurement policy. So if there are businesses who are innovating, and as part of the public sector support for innovation, for public sector procurement contracts, there's a requirement that you should be building technological capabilities and innovating or conducting R&D. And that is one mechanism to stimulate greater private sector expenditure on R&D and innovation and technology in the national system. And we suggesting that this should be explored further as a possible policy stimulus mechanism. Thank you, colleagues. I will end there.
Thank you very much, Glenda. Thank you, Chairperson. So that's what we were able to put together, and we're happy to take questions, Chairperson. Thank you.
Thank you so much, Prof. and your team. Honourable members, it's your turn to reflect on the presentation which has been presented by the Human Sciences Research Council. You know, we've got 3 minutes to put your questions or to make your comment. Let me see. Can you please take the presentation off the screen, please? Okay, can I hear names? People want to talk. One.
Mlenzana.
Lenzana.
Dihale.
Matafa.
Sheikh Imam.
Sheikh.
Dennis
Did
Joseph?
I hear you, Honorable Joseph? Yes.
Kaiso.
Honorable Kaiso. I see Peters is struggling. Peters. Honorable Peters, just trying to show a hand. I've got Honorable Lenzana, Honorable Tihale, Honorable Sheikh, Honorable Matafa, Honorable Joseph, Honorable Kaiso, Honorable Peters. In that order, my stopwatch is on. Hey, Honorable Lenzana.
Thanks, Chairperson. Thanks for the warm words of appreciation that today I'm turning 21. Let me also welcome Chairperson this well-prepared presentation from our learned people whom we always trust. Chair, just two things. One, Chair, is the slides are not numbered, but I think it's slide number 7, which talks on, in fact, they're raising concerns regarding service delivery focus areas vis-a-vis the COVID-19 austerity measures. I am coining it my own way. But then, Chair, if our learned team can advise us as appropriations as to which service delivery areas where they would suggest that there be cutting, because at the end of the day, we have to do some cutting. That's one part of it, Chair. Then the second one would be on basic education. In the light of the pre-existing, or let me say even the existing disparities in educational outcomes between the former Model C schools and the disadvantaged schools generally in South Africa, what measures could be put in place to mitigate the effect of these missed school days, particularly for those learners who have not continued learning during the lockdown? Then the lastly, Chair, it's follow up to this one would be now taking us beyond the 2020 financial year. How can they advise us in terms of education expenditure budget, which would need to redress this that I have said? Look, for instance, now there's a huge infrastructure backlog in schools and everything that we have to look into. Thanks, Chairperson. If there is extra time, give it to Medipo.
30 seconds. Honorable Tihale.
Thank you very much, Chairperson, and let me join my colleague in thanking the Human Science Research Council for their presentation, and also to say happy birthday to you, birthday boy. God bless you.
Thanks, Mahoshi. Thank you so much.
Thank you. Chairperson, on the frequency of hunger during lockdown graph, I really want to know where did they have their survey, because I don't think it represents Limpopo province when it comes to the percentage with the rural areas. I'm saying this because the learners now are no more going to school and they're no more getting food for feeding scheme, and the drop-in centers are also closed. They don't drop in after school and eat and have their package for the night. So if they are saying it's 30%, 30.9%, I really don't know where did they make their survey. But anyhow, I don't think it's Limpopo province. On the mandate, they are saying they want to respond to the needs of vulnerable groups in the society. I would want to say we all know that the people in the rural areas are unemployed. And it also covers the budget redirections, where they talk about food, where they made a several survey which indicate high prevalence of hunger, and number 5, which talks to the economic opportunities. So my question based on this one, that after their research, how can they really assist these people in the rural areas with funding for the projects? Because if they can try to assist on that one, I'm sure many people will be employed and they'll be able to assist themselves. And then the last one is on the service delivery under fiscal austerity measures of COVID-19, where they have made a survey and the traditional leaders told them the truth. This is the real truth in all the provinces where we have traditional leaders. The offices are closed and people are suffering. Our elderly, when they have to do the SASA things whereby they need letters, they are really stranded. They don't even know where to go. Maybe if at least one secretary in a traditional council can be able to go to the office and assist whoever, maybe the few, especially the elderly, I think it will assist. Here, I give them 100% correct with their research. Thank you very much, Chairperson.
Thank you, Honorable Khale. Honorable Matafa.
Thank you, Chairperson. Thanks for the presentation, and let me join Madi Khale in wishing Comrade Zembo a happy birthday. Skulele leadership.
Thank you so much. Thank you so much, leadership.
Chair, I will take the presentation from the tail end, where we are speaking of a noticeable decline in innovation expenditure. One of the goals by the president is that the economy should grow by a rate greater than the growth of the population in the country. And in other areas, it has been mentioned that innovation can be a key economic driver. Now, they mention policy interventions in terms of how maybe we can include innovation in the procurement space. My question is, do we have a view in terms of why private sector is not necessarily spending in innovation? Why is there a decline? And I want to contrast this with the non-spending of private sector in the mainstream economy in terms of investment. We've been lamenting that the private sector sits on a lot of private cash in their bank accounts without directly investing in the economy. Something that actually, it's amazing to see that in the COVID pandemic, the private sector has really come through and assisting. So there is a willingness to participate. What is it that has caused this particular private sector to withdraw from spending in innovation? Coupled with that, Chair, is the fact that the presenter did mention that we might have to cut. So meaning that as the public sector, the spending on innovation would not be necessarily sustainable. So I just wanted to ask, are there any long-term policy stimulus mechanism that we can ensure that we introduce in the space of innovation to ensure that that spending is not cut? The last one, Chair, is on the issue of human settlement. Professor Swartz mentioned a possibility of social protest, and we agree, because we have realized that most of the deep inequalities that the country faces is mainly in the urban poor areas, predominantly in the informal settlements. So I just wanted to find out if whether have they made a study to have a view if whether local government is adequately prepared and adequately resourced in how they mitigate or adapt to pandemic outbreaks, and if whether the disaster management funds that are normally put for disaster events for local government are sufficient, in a sense that when pandemics of this nature hit, they are able to be used according to the need of the country. Thank you very much, Chair.
Thank you, Honorable Sheikh.
Yeah, thank you very much, Chair, and thank you for that presentation. Let me say happy birthday to my colleague, but I will eat the cake alone tonight.
No, you're welcome. You're welcome. You're welcome. Welcome. Thank you so much.
Chair, let me start off by asking the Human Sciences Research Council, how seriously does government really take the research that they do? And I know they're doing a fantastic job. They're providing the data, they're providing the statistics, and we welcome what they're doing. Because and what prompts me to ask this question, Chair, is this. We went into a lockdown, and here the average is 30% of South Africans went hungry. On every day at any given point in time, 30% of South Africans are hungry, whether they in informal settlement, RDP houses, or whatever it is. Now, when we put in regulations of this nature, do you think those regulations justify taking into consideration that 30% of South Africans at any given time are going to be hungry, and that we will not be able to service them and provide them with at least a meal? And added to that is now the easing of the regulation based on the fact that you say that, South Africa has been doing exceptionally well. And yes, I must agree that we've been doing quite well in terms of containing the pandemic. But remember, we've eased the regulations. There's chaos out there. People are going hungry. I'm not sure how long more we're going to sustain that. Now, the other thing is this, you talk about that there's going to be a 66 billion rand less revenue from South African SARS. But I think the latest estimate from SARS up yesterday was about 248 billion is what they're expecting to be a shortfall based on all the revenue collection on customs and excise, on taxes on cigarettes and alcohol and personal income tax and things. So what effect do you believe this is going to have in being able to deliver services to the people? Remember, we've been having a lot of challenges pre-COVID-19. The unemployment rate in the country is exceptionally high. Now, I'd like you to tell us, based on all the research you're doing, how long do you believe it will take us to recover from this, where people will be able to go back to some kind of normality there? Now, you speak about, I think there's about 1.9 million people on looking for homes and housing in South Africa. And if you remember, not long ago, we've introduced, which was the Human Settlement Development Bank. And the purpose of that Human Settlement Development Bank was to provide service sites to people, give them a loan so people can put up their houses. Can you tell me if you've done any research into it, in being able to provide? Because remember, at 1.9 million people, you're now reducing your urban settlement development grant, you're reducing your human settlement development grant. It clearly means that that figure is going to escalate over a period of time. And Chair, do I still have some time there?
Okay, we are on injured time. Please continue.
Do you not? I'd like you to tell us, how much of research are you doing, particularly in the urban, the rural areas? What is your view, if I say that should we not look at trying to make rural towns into urban or semi-urban towns, making them self-sufficient, because municipalities are not able to survive because they don't get enough rates and taxes from these people. Should we not incentivize and take businesses and industries through to these areas so that we'd be able to deliver much better service system? And lastly, you speak about basic education. I see two very important things you don't talk about there, and that is the water and sanitation. We still have pit toilets, and many schools in South Africa still do not have water. So if you can just touch on that. Thank you very much.
Thank you, Honorable Joseph. Honorable Joseph, please come in.
Thank you, Chairperson. Good afternoon.
Thank you.
Thank you to Prof. Saudin and the team. I just would like to say in the beginning, I think the NDP point raised was important, but I think the pillars itself that it stands on, I look at the one of, for example, the economy. The pillars in itself is challenged besides the programs that we need to roll out to get to the NDP objectives. My question to the Prof is, there's a budget cut in your area. What programs will suffer or be compromised for us to get to the NDP programs? Are you directly affected, and what programs will it be? Will be compromised if there's a budget cut in your area? To Professor Swart, I would like to say, yes, I'm concerned about service delivery, and particularly vote 4 as raised or mentioned. I know that the traditional and Khoisan leaders bill was signed into act by the president, even without a budget. There's no budget, and so that is a big challenge going forward in making use of traditional leaders and the role that they need to play. And then I appreciate the comments and on the slides that deals with the metrics, the ECD. I think that's critical. It's important. But to Professor Kangalani, I just would like to ask. I'm not sure if the Human Science Research Council is doing surveys on the ban on alcohol and tobacco under COVID-19 at the moment, if they do research on that. But my question is, Chairperson, the current programs in the hospitals that relates to alcohol incidents. I read in the newspapers about 9,000 incidents over weekends. So my question is, are they doing research to see how much money we save now in the health department, in the hospitals, on incidents due to that is alcohol related, and where should that money be shifted to? The savings that we do currently experience, that the hospitals do not have these incidents that is alcohol related, and should it be challenged to health and to COVID-19 projects? Thank you, Chairperson, for the opportunity.
Thank you, Honorable Kaiso.
Thank you, Honorable Chairperson. Let me take this opportunity to welcome and wish my colleague, the Honorable Mlenzane, best happy birthday today. Hopefully he will share with us the cake tonight.
Yeah,
let me quickly come to the presentation. I think it was a detailed presentation, and it is going to enable us to explore the means as to how do we navigate in this difficult situation that we find ourselves since the breakout of the pandemic of COVID-19 in the country. Let me go to my first question. I want to understand from the research, in as far as we have in the country the creation of job opportunities, such as expanded public works program and community works program. And one of the objectives of such program was to empower our people with skills that are needed at the job level. But I want to understand, to what an extent has that actually resulted into what we are looking for, especially when looking at the former participants of these programs, external public works program and the community works program? Can we safely say that has now translated into a quality that we are looking for? On agriculture and land reform, I just want to understand what impact or the impact of COVID-19 on food security, and how can the budget navigate this impact? On higher education, we are talking about fourth industrial revolution, and looking at our institutions of higher learning, there's a lot of competition in terms of training and let me say curriculum. Presenting there's a lot of competition in the institution of higher learning as to who is going to produce the best of the skill that is needed in the country. But then can the research tell us safely that is our institution in that, can our institution at this stage match this development in terms of fourth industrial revolution? Well, the issue of on human settlement, I want to understand how can the government policy and budget for human settlement provision ensure that local government are adequately prepared for and sufficiently resourced to adapt to pandemic outbreak in future. Now, maybe this one, the research should have actually completed to talk about it in another way, not just to say the 13% of the population or the patient who are on chronic medication were being affected during this process of during this outbreak of pandemic of COVID-19 and could not fetch their medication. And you could imagine that ordinary people from the rural and informal settlement were mostly affected due to transport because of unavoidable regulation of lockdown. Now, what does this mean?
Kaiso, yeah, serious injury time. Finish your point.
That was
finish
my
your
last
point.
No, I'm finished. Just wanted to understand to what an extent has this had impact on those patients on chronic medication, because it's very important that point. Thank you very much.
Thanks, Honorable Kaiso. Honorable Sarupen, I don't know whether I jumped you and so on. I was still in. Honorable Sarupen. Okay, I'm not sure whether you are there. You might have got cut. Okay. Honorable Peters, if Honorable Sarupen comes back, please indicate it to me. Thank you. Honorable Peters. Honorable Peters.
Chairperson, I lost out on the entire meeting, but I had one question that I probably can ask, although I am at a loss for. It's related to the presentation made by, I think it was Professor Noor, or I don't know. I just wanted to find out what is the relation. Oh, let me start correctly. Thank you very much for the presentation, professors and the HRC team. And Chairperson, my questions will be very short. What is the role of HSRC in the planning processes of provinces and municipalities? But also with regard to developing a capable state, what is the relationship between HSRC and the School of Government? with regards to the issue of hunger and the research that was done, I got worried because there's an indication that hunger is more prevalent in the informal settlements, but it doesn't tell us whether it is the informal settlements which are surveyed for development, or is it the illegally occupied land? Because we do have informal settlements that will never be developed because it is land that is not necessarily set aside for development, but also the land that has got some challenges in terms of development. Then the issue of hunger for students. I just want to find out if HSRC has ever done an impact study on the NSFAS, because one would want to know whether this is students who are in hostels in the universities, because there is food at the hostels. And if it is those who are on NSFAS but are renting out in the communities or outside accommodation, then it means that the NSFAS is not being used properly by these particular students. Or are these the ones that we call the missing middle? Because you'd find that there are public servants who send their children to university. They can only pay for studies, but cannot pay for accommodation and food. With regard to taps in informal settlement, I would also say the same thing that I wanted to raise, Jefferson. I can see you want to cut me. The same thing that I wanted to raise with regard to hunger is this water provision in the informal settlements that has not yet been proclaimed, or is it informal settlements that have been proclaimed? But also, Chairperson, COVID-19, the impact thereof on the National Development Plan targets. Is the HRC able to indicate to us whether these targets are under threat now with COVID-19, especially in view of the fact that there's no vaccine? Thank you, Chairperson, for now.
Thank you so much. Honorable Sarupen, are you back?
Chair, yes, I'm here.
Please.
I'm having some problem with my video because of poor signal, so if you will allow me, I'll have to speak without it.
But Chair, you can hear you very well. Yeah.
Great, thank you. Chair, I just have two questions, and that's regards to the cuts that the HSRC has identified, mainly in local government support and management, and the cuts around the traditional leadership component, both in vote 4. Has the HSRC actually looked at the provincial government departments' budgets? Because a lot of the LG support actually happens from provincial to local government, because the Constitution very clearly states that local government is the custodian of provincial government is the custodian of intervening in local government and monitoring. And national government plays a very high-level supportive role in that, but really only provinces can place these municipalities under administration when they fail and so on. And so a lot of the support happens there. And so there was a lot of duplication going on in government already with these programs. And have they also looked at the underspend on this program in previous financial years before coming to that conclusion? And then around the cuts to the traditional leadership component, the same thing applies, Chair. Provincial governments do set aside support for traditional leaders where they have traditional leaders in their provinces, KwaZulu-Natal being the most prominent one, of course. But national pays traditional leaders for attendance at meetings for the House of Traditional Leaders. And have they looked into what the impact of the inability of that House to convene is on finances before coming to that conclusion as well? Thank you, Chair.
Thank you so much, Honorable Sarupen. Let me come in and again join my colleagues in welcoming the presentation from Professor and his team. A few questions from my side. On inclusive economic development. A question to the team. How far do you think we have progressed as a country on this one? That's number one. Number two, what instruments or levers does government have to achieve this noble objective. Again, just taking on income inequality, which is very bad, approaching 0.7 when you measure with Gini's coefficient. What is it that the country is not doing right? Or the other side of that question is, what should the country do to try and address this? Because despite the government's intervention, income inequality is just worsening. Professor Noro, you speak of fiscal austerity. I just want to get your thinking. Do you think that that's still a correct terminology to use when the government has announced a 500 billion rand stimulus package, and when you look at other interventions, the minister has been saying that it's over 800 billion rand to 1 trillion rand. Do you think it's a correct characterization of the way the budget is, of our budget, and you say there's fiscal austerity? Can you have stimulus package and fiscal austerity in the same line? I think that's the point that I'm raising. There's 20 billion rand reallocation to health. That's another. But you are also making a point that it's not sufficient. I would like to know, because that presupposes perhaps that money is a panacea of the problems that we are having here. When will you say that the budget that we are taking there is enough? What would be a comment as far as the capacity of the departments of health? I'm using plural form because I'm talking about both national and provincial departments. Their capacity to deliver on health expectations of our people. We are very clear on identifying areas where you say there's not enough budgeting. We need more funding, so on and so forth. There are a number of them where you keep on saying, no, this is not enough, and so on. But very thin in talking about the research perhaps that has been done as far as revenue enhancing programs that the government or the country can get in. As you know, that when you talk about expenditure, the other side of the equation, it's revenue. If we keep on talking about it, that we need to increase on this and so on, and the appropriation bill talks about what is available, both from the receiver and from what we go and borrow. But I'm just saying, you are very thin as to how do we enhance the revenue side of our equation. I think I'll leave it at that and allow you to respond. And you do have about 30 minutes to respond. You don't have to take all the 30 minutes, but so that we also receive quite adequate responses to the issues and questions which were raised by the honorable members. Thank you very much, Professor.
Thank you very much, Chairperson. And thank you to the honourable members for those very perceptive questions. Let me say from the outset, Chairperson, that we will not be able to definitively answer all your questions. There are some questions that will require further investigation, and I'd like my colleagues, when they give their responses, to highlight those. But let me start off by dealing with some of the general questions which were posed to us about the relationship, particularly of the HSRC to government. Honourable Imam raised the question about how seriously government takes our research. I'd like to talk to that. Honourable Member Joseph raised the question about how our work is going to be compromised as a result of these changes. Honourable Member Peters raised the question about our relationship between the HSRC and the School of Government. And I'll talk very quickly to those, but I'd like to ask my colleagues to answer the other questions. And I'd like Nanya Bola Miller to go first, please. So how seriously does government take us? An illustration here, Chairperson, is what's now happened with this COVID-19. When COVID-19 first dawned as a serious problem which we needed to deal with, our Department of Science and Innovation, immediately came to us and said to us, how can you help us understand what the response of the South African public is to what is going on? Now, fortunately, we had already begun looking at this particular question, and I'd like Professor Zuma to react if he wants. But before government had even asked us, we had begun to put in place a mechanism inside of the HSRC to be able to deal with that. And coming out of that, we were able to do a number of surveys which answered that particular question. And 2 weeks ago, we were able to talk directly to the National COVID Command Council. And we really appreciated that opportunity to be able to do so. So we spoke and were able to address pointedly the questions and the questions at that particular point about the lockdown and what was going on in the country around the lockdown. We had fortunately answers too. Now, of course, you might say that these are exceptional circumstances, but I'd like to say that I think that we have a really good relationship with our line department, and we're able to feed into levels of decision making and policy deliberations in our department in meaningful kinds of ways. And we'd like to, and particularly now in thinking about this theory of change, we'd like to think that we all, not just the HSRC, but the whole of the science community ought to get better at that. The whole of the science community ought to get better at how its research can be put to practical use to respond to the urgency of the situation in which we find ourselves in. So I'm saying we're doing reasonably well, but I think, Honourable Member Imam, that we can be doing better. So that's my first response. To your question, Honourable Member Joseph, about what programs are going to suffer inside of the HSRC as a result of this. Now, we have a very broad mandate, and as we confront this reduction in our grant, there are some things that are going to instantly give. And one of them that I'm very anxious about is our capacity to be able to deal with capacitating new researchers coming into the research community. And we were told today in our discussions with our department that we are going to have to adjust some of our targets that we have committed ourselves to. And the suggestion already is that the training target is going to be an easy and a soft target for the HSRC. I am very anxious about that. We may have to do it, but I'm really anxious to say to you that if we are not able to secure the capacity of our future generations to be able to come to do what we are now doing here with you today, our country is going to be in trouble. And, you know, if we don't have this expertise, and expertise is a loaded word, but there's no, I think, being squeamish about saying if a country does not have the scientific capacity to be able to deal with the complexity of the problems that it is confronted with, we are going to be depending on common sense and our best feelings about all of this, and those aren't sufficient and aren't adequate in terms of dealing with what is coming down the track. Let me make quickly this comment to Honourable Member Peters about our relationships with provinces and with government. We can do better. We're in relationships with metros. We're in relationships with provincial governments. We are able to do commissioned research for several governments, provincial governments in the country. But again, I'm going to say to you, we could be doing more. We have the capacity to do more. We have the will to do more. And we should be doing more. We have a working relationship with a School of Government, Professor Levine, who is the head of or was the head of the School of Government. He no longer is. Was in a good relationship with us. He's worked with us closely on a number of occasions, and we hope to be able to continue that, with the new head of government. I'd like to hand over now to Professor Bola Muller to please answer the questions that pertain to her, please.
Thank you very much. I'm not sure if my camera is working, but I did try to fix it from my side. Just to answer.
It's working now. Welcome.
Is it working now? Oh, that's good. Thank you. Just to answer the question also that was posed around the National School of Government, we had a very nice interaction with the new head, Dr. Busani Mkaweni, and we are going to be working much more closely with them. This has only happened in the last 2 days. And particularly around finding out the challenges that public servants are facing during this difficult time, what kinds of challenges they face in terms of new skills that need to be learnt, and new ways of doing things. So we're very excited about working with the National School of Government more closely. And I just felt I needed to tell you that because it's a new development. With regards to the austerity, yes, austerity was not really the right word to use. We could say fiscal constraints that we are referring to here. For example, the debt to GDP ratio. But certainly the stimulus package is not a sign of any form of austerity. What is also very interesting that came up, a comment on the slide, was the SARS generation shortfall of 66 billion that has now risen to over 270 billion. This data was taken from Minister Mbowene's interventions, and it shows that we are really facing very difficult times as we start to calculate and recalculate what we are going to be losing in terms of SARS revenue, and that needs to be seriously considered. So there was a question about whether we've done research on alcohol and tobacco. We did have a question in our survey as to whether people would like that, to see that as a policy intervention, the sale of tobacco and alcohol, and actually a very low percentage for both of those. There was under 15% support for the sale of alcohol and tobacco. And this is representative of the nation because of the weighting that was done by one of our former statistician generals. But there's obviously a lot of other issues that are related to this. For example, providing support to addicts and those kinds of things that we need to consider as we look at the fact that syntax is a very important part of the revenue that SARS gets in. And the issue around hunger, I mean, we've just put this into the public domain, and we would very much plead for serious attention to be paid to this, because members of communities are also saying that there is still corruption around the delivery of food parcels, and this needs to be addressed urgently. So I think those were the questions that were posed to me. I can hand over to colleagues. Thank you.
Charlene, will you go, please?
Certainly, thank you. So colleagues, there were quite a few questions around food security, and I think some of the answers cut across a number of the budget votes. So, smallholders and land reform is one part of ensuring food security, but also the Community Works Program and the Expanded Public Works Program. One of the members asked, what are the outcomes of that, what successes? And in a sense, we were hoping that part of the successes of those programs would be job creation. We don't have evidence that that is the case, but what we do have evidence for from our research and others' research is that it contributes to food security amongst communities, the Community Works Program, the Expanded Public Works Program, and it also contributes to infrastructure development for the country. So a lot of those programs are around water, fire, roads, etc. And so the Expanded Public Works Program actually contributes to food security in a number of ways, although it doesn't do what we also hoped it would do in terms of job creation. The chair asked a really important question around instruments or levers to, kind of end poverty and inequality in our country, and what are the drivers. So in our understanding, we've got a number of macroeconomic policies that we are busy. We really need to have bigger macroeconomic policy debates. I mean, the levers and the drivers are government spending, it's taxation, it's money supply, it's interest rates. And a lot of those things have been dealt with in the last little while, including where we go to for loans and at what rate and with what conditionality that applies to that. It's really our opinion as the HSRC that we haven't done enough debating on macroeconomic policies. In the last 26 years in our country, we've changed and we've experimented with different forms of macroeconomic policies, but it's probably time for us to rethink some of our plans and to have a really good look at macroeconomic policies for the country. And again, around the issue of stimulus packages, we're busy working at the moment on a comparison between stimulus packages that were given out, not in South Africa particularly because we had the benefit of the 2010 World Cup around the time of that recession, but around the world, like what makes stimulus packages work really well, and how do we avoid some of the perverse or unintended consequences of stimulus packages, especially around private industry, etc. Then there were quite a few questions around education, higher education and basic education. And colleagues, that debate is really polarized at the moment. Should schools be going back? Should they wait? And I think the member who asked that question kind of hit the nail on the head. It's going to be incredibly detrimental for young people who are already impoverished and who are in township schools, for example. Not just the nutritional loss and health losses around not getting a regular meal a day, but also the cognitive loss. Being out of school is going to have an impact. And I think I want to just say that it's not about regaining the lost school days. It's regaining the lost learning and the lost cognitive development. And I want to, and I think that one of the things that's happening at the moment is the Education Learning Channel on SABC radio and television is an incredible way for parents who are at home with children to begin to offset those losses. But so is distributing learning materials. And that hasn't had a strong enough impetus around the country. We really could use SASSA drop-off points where when people go and collect child grants, they could also go and pick up educational packs. there's lots of people thinking about ways that lost learning can be mitigated. And I think that's important as we think about where money should go going forward. The Model C schools, most of the young people are going to be fine because they've got parents who are doing homeschooling, they've got online learning. But remember that our Model C schools, our former Model C schools, also have a significant number of young people from poorer and working class communities, and they don't need to be left behind. Colleagues, the one last point on the basic education is that you'll remember that just after democracy, we had a huge number of young people wanting to start school, and we delayed, we extended the age. So we kept people back from starting school. And so one of the big debates now is, what do we do about progression in the midst of this crisis in education? And there's an argument for everybody to start again from next year. Because it doesn't really affect the fiscus except for the grade 12 exiting group. Higher education, there were again a number of questions. I just wanted to respond to the one on the fourth industrial revolution, because it illustrates the dilemma that we have to face. We have to both ensure that we have our eyes are pointed to the future in terms of where jobs are going and what kind of innovation we can jump onto, as well as sort out basic issues of students going hungry and NSFAS, kind of contributing to some of those problems. I'm trying to think of what other issues there were that I wanted to address. Of course, a lot of our work is around rural areas, and I think the one member made a comment about, is it not time to make rural villages and towns into more self-sufficient communities? And we certainly have got a lot of research on that in terms of food security, but also at the moment with the COVID crisis, a lot of people are wanting to go back to rural towns. And some of our researchers are saying that that's a really good idea as long as we do testing before people go home, because there's a lot more security in the absence of work in rural communities. There's potentially security in rural communities. I'm going to leave it there. There were many more questions that were very interesting, and thank you very much for those.
Okay, Kangalani.
Yes, there were a few questions on the areas of health. Indeed, we do conduct research on issues of alcohol, but obviously mainly as it relates to health issues and the work around behavior and all that that we conduct our research on. But we have not yet at this stage conducted research as yet as it relates to the in a way the health or economic benefits of not making alcohol available during this lockdown period, for example, and the resources that actually would otherwise have been used to deal with the consequences of abuse of alcohol. But our research involves also research on other substance use. So we do need to conduct further research to really identify more the economic benefits related to this and the savings, financial savings that would have been made, and how these savings actually could be redirected to other areas that would be mainly needed. Now, coming to the issue of 13% of the population indicating that their chronic medication was inaccessible during lockdown. Well, this issue does not only speak to the current situation, it also speaks to the realities that many people face, especially in the informal settlement in rural areas, because of their, the proximity to the areas where they receive primary healthcare support, which is quite far from where many people live. And that is why, if you look at the work around public health, you find that people in informal settlement are the ones who are mostly affected by these epidemics because they are not very close to where the services are. And therefore, the question that says, what does this mean? And to what extent has this had on people? The issue is, this says, as a society and as a country, we do need to invest a lot in primary health care. We do need to invest a lot in bringing services much closer to where people are based, because if you look currently with people not being able to move, where there are areas where they get chronic medication is quite far from them, it's already almost difficult and very difficult for them to access medication. Even after the lockdown period, those are still the challenges that our people face. So we do need to invest a lot in primary healthcare services and bringing these services closer to people. I think these were the two main questions that related to health issues. Thank you, Professor Lee.
Thanks. I'll just ask Prof. Simbayo, who has joined us, whether he wants to answer the questions about the survey and Limpopo, first of all. And a question also about possibly whether you can answer the question on settlements and housing. If he can't, I'll take a stab at that, Chairperson, and then I'd like to just answer or try and answer the remaining really big questions that honourable members have asked, which we have not in our responses yet addressed. Likeness, do you want to say something quickly? He's not responding, Chairperson, but let me just say that I can't...
Sorry, I was muted. My sincere apologies. Thank you so much, and good afternoon to honorable members. I'm going to attempt to answer just a couple of issues that were raised. One was about how representative the sample was that was used in the surveys in terms of informal settlements and rural areas. To date, we have actually done 2 of these surveys. The first one before the lockdown started. A criticism of that was really that the sample was biased, as the majority of people who had responded were primarily from urban settings. And there were very few, when we looked into the matter, of respondents who were from informal settlements and from rural areas. But in the second survey, which was presented recently, including to the National Command Council, that survey deliberately included expanding, instead of it being all online based, we actually were able to phone more people from rural areas as well as informal settlement. Luckily, we had access to databases where we had cell phone numbers of people. So the second survey was actually much more representative in that regard. But safe to say that when we do studies like this, we normally try to correct for the fact that we are sampling this way by benchmarking on the national population. A second aspect is there was a question about how long this crisis might end. The answer to that is clearly no one knows. But based on observations of a few countries that have gone through the brunt of these national epidemics in their own countries, it seems that an initial phase lasts between 2 to 3 months, after which there is a drop in infections. But many people have been worried that there might be a resurgence of the epidemics unless if within the coming year there is a vaccine developed or treatment which becomes available. Now, another point, and my last one, is actually just to share one's enthusiasm here with regard to how the status of science has kind of been advanced through this global COVID-19 crisis. It's interesting how you see in many countries, the political leaders of these countries have been able to present arguments for the actions that they are taking. And this has happened in our country too, on the basis of science or scientific evidence. I think if there was a positive spin to all of this, is how science has really been shown as being most useful when it comes to helping provide solutions to problems that society faces. I will stop there and thank you very much.
Yeah, thanks very much, Likeness. So, Chairperson, before I hand over back to you, there were 3 questions, key questions, that I'm going to say that we are unable to answer those questions unequivocally and categorically. Those questions were first of all, a question that that Honourable Member Mlenzana raised about what should be cut. He said, "You're not telling us what should be cut." And then we were also asked the question about, and I think you raised it, Chairperson. You said you're not telling us where this money should be coming from. You're telling us a lot about what should not be discontinued, but you're not telling us about where the money will come from. And the last question was, how long will it take to recover? And I just put a little bit of a different interpretation on the way Professor Simbai has put it. And I think that question was, how long will it take for this economy to get back on its feet? And I'd like to say that in terms of all 3 of those questions, those are really difficult questions. And we are not, unfortunately, in a categorical position to be answering those questions. We have opinions, but we'd like to say that this is where the country now clearly is in need of, and we in the HSRC are beginning to take steps towards addressing that need, is answering this question about the macroeconomic future of the country. And we'd like to say to you that in the future, when we come to you, we'd like to be thinking that we would have more capacity on the basis of the work that we will be doing in partnership with the universities, with people in Treasury, people in the Reserve Bank, in the Statistician General's office, that we will be able to come back to you with a little more.
Prof.
Yes, Chairperson. Yes.
Sorry to cut you. I think let's leave it here. You know, this our virtual meetings, there are problems because somebody else must come in. So let me just thank everyone. Let me thank you and your team. I think you have given us quite an information which perhaps we may need to follow on. Please note our questions. We may have to call you back, and perhaps after some time, but we may have to call you back so that we continue this engagement. Honourable members, we are not going to deal with our minutes today. I want to postpone that for our next meeting. At least next week we're having more time. This brings us to the end of the meeting. But thank you very much, Prof and your team. And I think, as I always say, this was really helpful. Thank you so much.
Thank you.
The meeting is adjourned.
Thank you very much, Chair.
Thanks, Chair.
Thank
Thank
you.
you.
Thanks, Prof.
Bye.
Members, thank you. Right, let's in the meantime take apologies. Any apologies? Written apologies, of course.
Chairperson, from the Portfolio Committee, there were no apologies.
No apologies from the Portfolio Committee.
Yes.
Thank you very much. NCOP. Apologies from any honorable member from NCOP.